The Genuine Article. Discussion and commentary based on articles from JACC.
Hello, I'm Tony DeMaria, the editor of JACC, here with another issue of the Genuine Article, and I'm talking to Dr. Mark Banaka, and Dr. Banaka is at the Brigham and Women's Hospital, and he's a member of the TnI study group and the first author on a very interesting paper we're publishing in JACC that deals with the very high sensitivity troponin assays that we now have available. So tell me, Mark, what got you interested in looking at this question?
Well, the advent of newer, more sensitive troponin assays has allowed us to identify a larger proportion of patients who present with suspected ACS who are troponin positive or who have elevated levels. And there's been debate as to what the prognostic implications or clinical importance of these low-level elevations are. And so that was the question behind this study.
Yeah, you know, those of us as clinicians, we deal with the fact that the performance of these tests is somewhat imprecise. There's always some false positives and some false negatives. And as the sensitivity of these analyses gets sharper and sharper and sharper, we're wondering if we're trading sensitivity for specificity to an unacceptable degree, if we're putting a lot of patients who really are not having ACS in the hospital because of the troponins.
I think those are important concerns and ones that clinicians feel widely, and I think the important part of this study and others that have come in terms of diagnosis is to verify that these low-level troponin concentrations, when detected with newer assays, are indeed important. One thing I think that needs to be stressed is that this test needs to be evaluated in the correct population, and that is a population with suspected acute coronary syndrome, and not necessarily can these results be extrapolated to all patients that come to the hospital.
Sure. So how did you go about answering this question?
Well, we tested the performance of one newer, more sensitive assay in a population with suspected acute coronary syndrome. And we looked at the prognostic performance cut at the 99th percentile, which is the current recommendation of professional societies. And we found excellent prognostic performance at that cut point. In addition, we took a special look at those with low-level elevations that would not have been detectable by prior assays and looked specifically at the risk and the prognostic important in this group. And again, we found that this group was at higher both short and intermediate term risk.
Can you give us some idea of exactly how high that risk was?
Well, in the overall group, using a cut point at the 99th percentile, there are about threefold risk compared to those that had no detectable troponin or a level below the 99th percentile. And specifically with the low group, at 1 year, they are at about twofold risk of death or MI compared to those with levels below the 99th percentile.
So some really good data demonstrating that these low levels of the ultra-sensitive troponin assays really do have some significance. So how has that changed your practice now?
Well, I think that we need to, even though this identifies a larger proportion, I think we need to make sure that we're using troponin in the appropriate population first. But in those with suspected acute coronary syndrome, when we find a troponin elevation, even if it's at a low-level concentration, we need to understand that those patients are at a significantly higher risk than those without detectable or without troponins above the 99th percentile. And we need to consider that in our treatment algorithms.
Well, this is useful information, I think, really. It helps bolster our confidence that when a patient comes in with an ACS-type presentation, that in fact, if they do have even very low levels of troponin that are elevated, that they're significant, and we ought to treat those patients as intensively as we would, even if the levels were a little bit higher. Thanks very much for being with us. For the Genuine Article, I'm Tony DeMaria.
The Genuine Article. Discussion and commentary based on articles from JACC.